Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. Okay, somebody else was told and shared with us, if you've ever breastfed a tongue-tied baby for 10 months already, it's unlikely to improve your pain when feeding to have the tongue tie released. So this person should just go on forever? Wow. That's sad. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Paladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Hello, everyone, and welcome back to the Tongue Tie Experts podcast. I'm Lisa Paladino, and I am your host. And today we are talking about myths and misconceptions about tongue tie, about lip tie, about breastfeeding, and a little bit of other stuff thrown in. So I put this question out in my Facebook group. I run a Facebook group called Breastfeeding Tongue-Tied Babies. Put this question out. Share with me some myths that you want to chat about. And my goodness, did I get an answer or like 50 answers. It was pretty incredible. So thank you to those who did answer and sent me emails and sent me posts. It was pretty incredible. And I want to go through them as best as I can and try to see if I can make any clarifications to what was sent in. Most of them were actual myths. Some of them were a little bit controversial. We'll go through all of it. Before I get started with that, I just want to let you know, first of all, thank you for listening to the podcast. I really appreciate it. And I would hope that if you enjoy the podcast, if you enjoy the Tongue Tie Experts podcast, you will follow it on your favorite app. I like listening to on Spotify or on Apple. Click to follow or subscribe, depending on how they have it on each particular app. It's a little different. And if you give it a rating, that is really helpful because then the message gets out to more people. So if you could do that, that would be really, really appreciated.
If you like a particular episode, share it with a friend. That would be wonderful. And then the other thing I want to let you know about is that if you're listening in the beginning of, no, not the beginning of the end of April, when this comes out in 2024, my Professional's Guide to Tongue Tie in the Breastfeeding Infant course is on sale. So you can check it out. The link is in the show notes, but it's tonguetieexperts.net/pro course. And in the show notes, you'll see the coupon code podcast15 to save 15%. The sale is only lasting through the end of May. So check it out. If you're listening to this after the sale, when you click on that link, you will get a notification that you can join my waiting list for the next time it opens up. Okay. And it's going to be exciting when it reopens. But for now, that's what you can do. And I hope you do join the course. Thank you. Okay, so tongue and lip tie misconceptions. Obviously, tongue and lip ties are often misunderstood, and misconceptions include beliefs such as these. Heard this from quite a few people, that tongue ties will stretch over time. We know that to not be true. A true oral restriction will not stretch over time and become functional over time. Not going to happen. Okay. Having baby's ties fixed as an infant will prevent all future issues. This is a good one because I've heard this quite a few times. I've heard people say, going to get the baby's tie fixed now so they don't have problems with speech, with eating, with breathing. And honestly, we don't know if that's actually true. We do not have enough evidence to say that we should release ties to prevent future issues. So I actually have a podcast episode on that. If you want to look back in my list of episodes, you'll find a podcast just on that topic. So that's a great point. Thanks to who submitted that. And when I first asked, I thought I was going to be able to include everybody's names, but the response I got was so overwhelming that there was no way I could do that. So, okay. Somebody said getting a tongue or lip tie revised doesn't always help nursing. Now, I don't really know what the responder meant by this. Do they mean that it always helps nursing and that's a myth that it always helps nursing? So I'm going to clarify. I'm going to talk a little bit about this. It doesn't always fix nursing, especially not immediately. It doesn't fix nursing if there's no other help going on and other things aren't accounted for in most cases. So it usually puts you on a path that with functional assistance, you will have improvement. But it's not an instant fix. It's not just a quick snip, but it should help. It should help. But there's other things in play. So this could be a rabbit hole, and I don't want to go too deep in it, but I do have other episodes that dive deeper into that. Okay. So if you have any questions about that, let me know. Send me a message, and we can definitely chat on that more. Oh, this was a good one. Tongue-tied babies always can't breastfeed. And that's absolutely not true. I had a baby in my office just the day before, yesterday actually, who was nursing very well from appearances. So this kid was breastfeeding. Nobody could say this baby couldn't breastfeed. However, this baby was not transferring milk. So that's number one. Number two, babies compensate. Babies are strong and smart, and they know that they need to get milk to survive. So a lot of babies can compensate and breastfeed. So that was a great point. Thank you to whoever sent me that response. Okay. Another myth. Lip ties cannot affect feeding and latch like a tongue tie does. Ooh, boy. I'm going to say that's definitely a myth. Now, that doesn't mean that every lip tie affects nursing, but I have had babies who only had a lip tie, and it definitely interfered with nursing. I've also noticed a certain pattern of babies whose lip ties are causing mom more pain than the tongue is. So that's a good myth to bust. Thank you for that one. Okay, this response was, once released, a baby won't have a boob aversion anymore. So, not sure what she meant by boob aversion, but I would say I would define that as a baby who's having difficulty nursing and not being able to nurse from the breast. And just releasing it will not necessarily help a baby to breastfeed. So there's a lot that goes into breastfeeding. We have to look also on the maternal side. So, we want to make sure that mom has milk. We want to make sure that baby has no tension going on, that they haven't had noxious things done to them that make them have an oral aversion or an aversion to breastfeeding. A lot of kids get really used to the bottle very quickly and don't understand how to move their tongues in proper ways to get milk from the breast. So just the release itself doesn't always solve the problem. So I think if you've listened to me long enough, you know what I'm going to say, that baby definitely needs to work with an IBCLC who's very versed on ties, very tongue tie savvy to get back to the breast. And, I don't often mention this, but if you're looking for a provider who has experience and education, on my website, tonguetieexperts.net, we have a list of all the people who submitted their names who have graduated from the Professional's Guide to Tongue Tie. So you can look them up by state, by country, by profession, and find somebody to help you out if you can't find somebody locally. Okay. Now, this topic is myths about effects on breastfeeding and latch. Pain during breastfeeding. Somebody was saying that pain during breastfeeding is normal and it's not necessarily a tongue tie. It's not necessarily a tongue tie. It could be the way the mother is holding the baby. It could be position. It could be baby not being able to open their mouth in a good way for other reasons. So it's not necessarily a tongue tie. But if there's pain with breastfeeding, we definitely have to evaluate for tongue tie. Slow weight gain. Slow weight gain can be because of a tongue tie, or it could be from other things. So slow weight gain could be from low milk supply. It could be from not offering the breast often enough. It could be from supplementing. Lots of things can cause slow weight gain. There could be something metabolic going on with the baby. So slow weight gain is not the only parameter for tongue tie. We have lots of parameters for tongue tie. Difficulty drinking from bottles or cups can't be caused by a tongue tie. Yes, they can. They absolutely can. Again, it's not the only thing that causes difficulty drinking from a bottle or a cup, but drinking from bottles or cups can cause a tongue tie. These are great, aren't they? People sent in so many important things to talk about. Then a whole bunch of you wanted to chat about pediatrician misdiagnosis. So sorry if you're a pediatrician and you are joining us today or listening to the podcast. It's not just pediatricians. There are lots of healthcare workers who can misdiagnose, overdiagnose, refer without functional assessment. Lots of things can happen in a medical office for those who aren't trained in all the things about tongue tie. Pediatricians may misdiagnose, or other doctors may misdiagnose due to lack of expertise. And I can hear you. I hear you in the background going, sometimes it's even the IBCLC. And yes, that's true. It could be a lactation consultant. It could be a midwife. It could be a nurse. If there's lack of education and expertise, this can be misdiagnosed and mistreated. So common misconceptions that we heard in the responses is that they don't know how to diagnose. So they haven't been taught about diagnosing ties except for the very obvious anterior type 1 tie. So they miss anything but that. So typically, if I have a mom call me and say, my pediatrician says my baby has a tongue tie, but I want to come to your office and make sure it is a tongue tie, or if we need a procedure, I know they're coming with a type 1 anterior tie. And I had one last week, and it was a classic heart-shaped tongue. Yes, the baby has a tongue tie, but you know what? That baby was transferring milk fine, and mom had a little bit of pain, not a crazy amount of pain, but her doctors had made her so nervous that she was afraid to just breastfeed. So you can breastfeed with a tie if it's working. So, okay. So, this is important. There can't be a tongue tie because of his weight gain. So some breastfed babies gain weight just fine, even with a tongue tie and a lip tie. So that's not the only parameter to look at, especially if mom is having discomfort. I don't know if you're hearing this. I left my window open a little because it's nice and warm today, and I'm hearing some sirens. Excuse those sirens. Hope everything is okay. Oh, this is a controversy. In my birth group yesterday, someone said breastfeeding at night causes cavities. That's a very controversial one. It's probably not the breastfeeding. Probably if the baby slept with a bottle, they'd be getting cavities. It has to do with the sugar content and milk sitting in the oral cavity, especially sometimes when there's a lip tie, the milk can pool behind there. But there is not more cavities with babies who breastfeed as opposed to babies who bottle feed. Have you ever wished you could help that mom who is questioning if she has enough milk? Ever wanted to either reassure her or know when to refer? As a lactation consultant, I created the program Understanding Milk Supply for medical and birth professionals to help you to feel more confident in those exact situations. This affordable, recorded video mini course is open to anyone who works with pregnant or breastfeeding families. It's a particularly valuable opportunity if you're an SLP or an OT who wants to gain an understanding of how breast milk is made, or a dentist in the field who is often the first-line provider for tongue-tie treatment. The function of the infant at the breast depends on milk supply. Even if care of the mom isn't in your scope, there are basic principles that you can learn that may rescue a family's feeding goals. In Understanding Milk Supply, I teach you what red flags to look for, when to refer, who to refer to, and how to advise the family in the meantime. And there's one LSERP included for lactation professionals. Go to www.tonguetieexperts.net/milk supply. The link is clickable in the show notes. And as always, you can use coupon code podcast15 to save 15% off this and all Tongue Tie Experts courses. Thanks so much. Now, many of you sent in myths about or misconceptions about treatment options. So this is another interesting topic to cover, and all the myths that go along with mistreatment or overtreatment or treatment options. So one of the people in my Facebook group said, one of the most important myths to dispel is a release is a quick fix that will resolve symptoms immediately. Don't we wish it was always like that? A release is not always a quick fix, and symptoms don't always resolve immediately. Sometimes they do, but most of the time, it's more of a journey than that. This is one that makes me go, Don't worry, at some point, your kid will fall and break the lip tie. Now, what other medical professional would suggest that a trauma would be a better way for something to be fixed than a simple procedure? I don't know. We'll see. Okay. Somebody else was told and shared with us, if you've ever breastfed a tongue-tied baby for 10 months already, it's unlikely to improve your pain when feeding to have the tongue tie released. So this person should just go on forever? Wow. That's sad. Okay. Oh, this was an interesting one. Um, Somebody was told when her baby was nursing constantly and not gaining, so she was nursing all day long. I call that the hors d'oeuvres nursing, right? You ever go to a party and there's just appetizers and hors d'oeuvres and there's no main meal and you eat and eat and eat and eat, but you're never full? That's what that's like. Some babies are taking sips all day long, but they don't get a full meal. So they're always want to be on the breast. And she was told that babies are just greedy and don't want to unlatch. Greedy? Seriously? Wow. Few comments about reflux. So, reflux as normal. Reflux is not normal. Babies should not be spitting up. Like, why would they? A little bit of spit up here or there. But a baby that is refluxing a lot of what they're taking in and being uncomfortable when it comes up, that's not normal. That's not normal. And is it a sign of a tongue tie? It could be. Could be something else. It could be a food intolerance. It could be the method of feeding. It could be the volume of feeding. Could be a few things, but it could be a tongue tie. So reflux is not normal and deserves an investigation. And not only pediatric investigation, but a lactation consultant investigation or evaluation. Oh, let's talk about, and a couple of people said this too, the white coating on the tongue. We got so many good comments, right? So the white coating on the tongue that happens when there's tongue tie is sometimes confused with thrush. Actually, I'm going to say more than sometimes. It's often confused with thrush. Thrush is white and chunky and it's all over the mouth, not just on the tongue typically. A lot of times it's in the cheeks. Mama will have symptoms. Of course, this is not medical advice, right? I'm not diagnosing anybody with thrush or milk tongue. But if you think your baby has thrush and you treat it, or the pediatrician prescribes something for it, and it doesn't get better, and you have no symptoms, it's not thrush, right? So we don't want to keep doing the same thing over and over and expecting a different result. White coating on the tongue happens when the tongue can't reach the top of the mouth because of the oral restriction that prevents it from reaching the top of the mouth. And our tongue gets cleaned by the motions that it normally should be doing against your teeth or gums for a baby against the roof of the mouth. So if the tongue can't reach the roof of the mouth, it's not cleaned and it could get a white coating. And typically the white coating corresponds to where the restriction is under the tongue. So you'll see it on the top of the tongue, halfway back, and right underneath where it'll be nice and pink and then get white. And that's where the restriction is because the tongue can only move in front of that. Very interesting. I have to admit, I've mistreated a lot of thrush before I understood this topic. So there's that. Somebody put as a breastfeeding myth, babies shouldn't be held too much. Babies can't be held enough. Babies deserve to be with moms. Babies need to be with moms. We are mammals. Mammals are creatures that keep their babies close. A baby is born as an incomplete human and needs to grow and develop and feel its parents' warmth and heartbeat and hear its voice. They need lots of love and closeness, especially in the first 3 months. What other myths do we have? Oh, this was one. This is very upsetting to me. And I will just say this outright. There is a policy by the American Academy of Pediatrics about treating jaundice. American Academy of Pediatrics has one. Academy of Breastfeeding Medicine has one. And in my area, at least, many of the doctors who treat babies do not follow the policies. So if a baby has jaundice, and I'm not talking about the kind of jaundice that happens immediately that can be deadly. I'm talking about jaundice of a bilirubin that's rising, baby's getting a little yellow. They do not need formula. If there is breast milk, they do not need formula. Actually, the breast milk is a laxative which helps push that bilirubin out. So jaundice happens when the bilirubin is high. Bilirubin is in the stool, that's the black stuff that makes meconium dark. So babies poop out that meconium, get rid of the bilirubin, and then they don't get jaundice. If we give them breast milk, the breast milk acts as a laxative and helps them poop quicker. And if we give them formula, it constipates them, especially because, at least in the United States, all the formula is iron fortified. And sometimes that can delay things. Now, the reason why it works, quote unquote, is because it's more volume. If a baby isn't feeding at the breast and mom does not have breast milk and we can't give donor breast milk, yes, we need to give formula, of course. But first choice should be helping mom to breastfeed more efficiently, getting baby to breast, hand expressing, spoon feeding, syringe feeding if they can't feed from the breast, and then see what happens, right? And if there is copious breast milk, giving that breast milk. So the sad story that happened was I had a baby that was 4 weeks old, and the pediatrician had told them that because the baby had jaundice in the hospital, they had to give 2 bottles of formula every day until he saw them again. There is no reason for that. There's nothing that's written about that anywhere. It made no sense to me. And the mom was upset because she didn't want to give formula. She had breast milk in the freezer, and she was giving her baby formula because the pediatrician said he needed it because he had jaundice in the first week. I don't know where they get these things. So anyway, I'm going to calm down and get off my soapbox because I can get upset. Okay. Another myth that was sent in was that babies should sleep through the night by 3 months. I think I had one baby that slept 6 hours in a row, sometimes at 3 months, but no, there's no hard and fast rule about when babies should sleep. They don't know it's night. Food intolerances. I'm almost done. We're getting through this list. All colic, gassy, mucus stool presentations need dairy elimination diets in the mom. Not necessarily true, might be true, need further clarification. And I will agree with the person who sent this in because I know her point. Her point was that people are being told to take dairy out without a full evaluation, without a full assessment about what's going on. So that's absolutely true. If a baby has a tongue tie, the breastfeeding mothers are told to just bottle feed. That's a good myth because how many babies can't bottle feed because of their tongue tie? Lots of them, including my own grandson. Good thing my daughter had a copious milk supply and was able to breastfeed the baby, even though he had a significant tie and a high palate and other things going on. He could get milk from the breast. He could not get milk from the bottle. So that's a myth too. Okay. And the last one that I have here is lip blisters are just secondary to breastfeeding. There's no problem. So for those who don't know, lip blisters are a classic sign of the lip being held in while breastfeeding, which causes blisters on the lip. So the lip holding on to the breast or the bottle even can cause lip blisters, and that can happen with tongue tie. If there's lip blisters, there's not necessarily a tongue tie, But again, we need to evaluate and assess that baby to make sure that there's no lip tie, tongue tie going on when we see lip blisters. So that's a summary of the myths that were sent in. If you can think of something I didn't cover that you would like to have me cover, please send me an email, lisa@lisapaladino.net. If you're listening to this on Instagram or Facebook, if watching on Instagram or Facebook recorded, you can send me a message through there with anything that I forgot. I thought it was a pretty comprehensive list, and I enjoyed reviewing it with you. We'll talk soon.
Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue-tie Experts Insiders. It includes monthly online meetups with me, Lisa Paladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue-tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.